welcome back to my YouTube channel Nursing Digipedia. So, in the last video we talked about how to interpret ABG by using Tic Tac Toe Method and also to differentiate whether it was respiratory acidosis or alkalosis, metabolic acidosis or alkalosis, whether it was uncompensated or compensated. So, in today's video, we are going to learn whether it is fully compensated or partially compensated. So friends, before we start this learning, please do not forget to subscribe, hit the bell icon so that you will be notified whenever I upload a new video. Now, before we begin to learn as how to conclude whether it is fully compensated or partially compensated, let's quickly remember the ABG parameters normal value ranges. So, the first one is pH and it is 7.35 to 7.45. The second one is HCO3 or bicarbonate, that is 22 to 26, and PCO2 or carbon dioxide, that is 35 to 45. Earlier with the Tic Tac Toe method, we found Tic Tac Toe, but it's not always necessary that you will find Tic Tac Toe, just like in this condition where your pH is normal. That means there is a full compensation going on and your PCO2 is in the acidic column and HCO3 is in the alkalotic column. Your HCO3 can either come in the acidic zone and PCO2 can go to the alkalotic zone. So, in such situation, your pH comes to your rescue. Since we know the normal value of pH is 7.35 to 7.45. So, when we closely analyze it, we have the absolute normal for a blood pH is 7.40. So, anything between 7.35 to 7.40 is acidosis and anything between 7.40 to 7.45 is considered alkalosis. Let's take an example so that it becomes more clear. We have blood pH of 7.38. That means our blood pH is normal. So we are writing pH in normal column. Bicarbonate is 18, it's below 22 means it's acidic. So we are writing bicarbonate in the acidic column. And PCO2 is 32, that means it's below 35, it's in the alkalotic column. So we are writing PCO2 in the alkalotic column. Now we have to differentiate whether it is respiratory or it is metabolic. When we further go and see the pH, that is 7.38. So, when we closely see the pH, it's coming right in between 7.35 to 7.40. So, it is falling in the acidotic side. Hence, we can conclude that there is an acidosis going on, which is originating from the bicarbonate side or the metabolic. So, we write it is metabolic acidosis, which is fully compensated because our pH is normal. So this is fully compensated metabolic acidosis. Let's take another example where our pH is 7.44. Our normal value is 7.35 to 7.45 and it is coming in between this. So we are writing pH in normal grid. So pH, we have bicarbonate which is about 26, that means it's in the alkalotic side. So we are writing bicarbonate in the alkalotic column. PCO2 is 48 which is about 45 and it is in the acidotic column. So we are writing PCO2 in the acidotic column. So by looking at this problem, we have pH normal, that means there is a full compensation going on, but we have to differentiate whether it is metabolic or whether it is respiratory. So for this, we have to take the help of pH. So when we closely look at the pH, we have 7.44, which is falling slightly to alkalotic side, which is between 7.40 to 7.45. So we can conclude that there is alkalosis going on, and which is originating from the metabolic side, that is a bicarbonate. Hence we can write it is metabolic alkalosis. There's a full compensation going on, so it is fully compensated metabolic alkalosis. We just learned how to conclude fully compensated. So let's take an example and learn how to conclude partially compensated. So we have an example where a pH is 7.30, which is below 7.35, that falls in the acidotic column. So we are writing pH in the acidotic column. Bicarbonate is 18, which is below 22, that means it's in the acidotic column. So we are writing bicarbonate also in the acidotic column. PCO2 is 32, which is falling below 35, so it comes in the alkalosis column. So PCO2 goes in the alkalotic column. We got a tic tac toe. So we conclude that this is acidosis going on, which is originating from the metabolic side. So we write metabolic acidosis. We know there is partial compensation going on because our pH is not in the normal column and our carbon dioxide is in the alkalotic zone. So we conclude it is partially compensated metabolic acidosis. So friends, that was the video on how to interpret ABG as whether it is fully compensated or partially compensated. Do comment and let me know how did you like the video. You are also welcome to suggest any other topic you want me to cover. So till then, stay safe and I'll see you soon with a new video shortly.